had an area of concern with the discrimination and the disparity. The young woman spoke of the language barrier. In the doula profession, do you have, bilingual people that can actually understand, different languages, and that's one question I had. The other one is, there again, you spoke, you were a labor nurse. Was administration or healthcare aware of, the lack of one-to-one? I would put it that way, because nursing is, I can't say enough about you nurses, what you do, but I think so much is expected of you people, and it challenges between the paperwork and I don't know what the ratio is now. What is the ratio?
It depends where you work and who your nurse manager is. It is, support in labor. Ideally, we would have one labor nurse there for every active labor patient. That doesn't always work out that way.
Wow.
Nurses are pulled from room to room because of volume changes. It's very unexpected. We also break each other. We change the care that we're providing. Nurses switch in and out of rooms, so it's not one continuous person providing that kind of support. And although I can certainly appreciate what nurses do, doulas are that stopgap measure. They are one-to-one with that patient, providing that confidence for that mother and developing a rapport that nurses struggle with. We do. They are usually in contact with their clients before the patient goes into labor, helping them develop a birth plan and understanding what their wishes are and teaching them how to advocate for themselves. The doulas don't step in and intervene with the medical providers. That's not their role. They teach the client, their patients, how to do this successfully and develop confidence in order to get their birth wishes known. So that's how, it stands apart from what labor and delivery nurses do too.
So you would actually, it seems like there's a disconnect between administration and there's so many infractions that need to be addressed in the hospitals themselves as far as healthcare go.
I was lucky to position myself to be the director of my unit so that I could change those things, but that doesn't happen at every hospital. And having that kind of philosophy was changed, my philosophy of care changed after I attended that doula workshop and understood the other things that really needed to be addressed in the birthing environment for women in order to be truly supportive and in order to maximize their outcomes and have them come away from the experience not traumatized but able to celebrate it.
Thank you.
Thank you very much for your questions.
Can I respond to the language question?
Sure, as long as...
So I'm really glad you asked the question about language.
Thank you.
First of all, there are many doulas who are multilingual, but I'm not, for example. And one of the things that doulas do, in addition to what we've described, is that we develop a extensive list of community resources. So, for example, I had a client whose primary language was Farsi, which is not a language that I speak, but I was able to, because of the network of people that I'm connected to, find a translator for that person. My client actually ended up not wanting to have the translator, but I was able to, as an advocate who has a connection to a network of resources, create that access that she might not have known to look for. And that's true of language, but it's also true of many other things. Like I had a client who was complaining of a particular problem that I knew could be solved by a pelvic floor physical therapist, which is something that my client didn't even know existed. So because I have this network, I can kind of light up those connections, even if those aren't skills that I have specifically. And then just speaking largely to the network also, most of the doulas in this room, I just like did a quick scan. We all have each other's cell phone numbers. So if I don't have somebody on my list, Susie might, and I can just text her and say, do you know anybody who's, can translate from whatever, like so we have these kind of like growing networks that we can light up.